Okay, so good morning, everyone. Hello, and welcome to today's webinar hosted by Injury Matters. My name is Apu, and I'm the Injury Prevention Officer here at Injury Matters. And I'm very excited to be facilitating this webinar today on evidence-based exercises for falls prevention. So thank you all for joining in. I know it's a busy time for everyone, and I'd really like to acknowledge that you all are taking your time out of your busy schedules to learn more about falls prevention and to prevent falls within the older adult community here in WA. And we're doing this on Whadjuk Noongar land. So I'd like to acknowledge the Whadjuk Noongar people who are the traditional custodians of the land on which I am facilitating this webinar today. And I want to pay my respects to their elders, past, present, and emerging. Australia always was and always will be Aboriginal land. I'd like to also know where everyone else is tuning in from today. So please use the chat box to acknowledge the land on which you are joining in the webinar today. So before we start, I just wanted to go over a few housekeeping points. So can everyone just make sure that your microphones are muted while we are speaking and the presenters are speaking? It makes it easier for everyone to hear about what everything to hear and the audio. And also we're recording this webinar, so just makes the recording a bit clearer as well. If you have more than one person in the room with you joining today, we'd appreciate it if you could please send us a quick private message just to let us know how many people are with you today. Just helps with our record keeping. Also, if you have any questions, please pop them in the chat box and we'll go through them at the end of the training. And if you face any technical issues during today's training, please write them in the chat box and we'll do our best to help you. So just wanted to start by giving a bit of background on who we are. At Injury Matters, we are for safer people and places. Injury Matters aims to prevent and reduce the impact of injury within the WA community. And we do this through advocating and providing education for injury prevention, as well as providing support for people who have been impacted by injury. And one of the programs we lead is the Stay on Your Feet program with the support of the Department of Health WA. The Stay on Your Feet program provides information, training and support to older adult community members and health professionals working with older adults such as yourselves on how to prevent falls in the community. And we do this through the Move, Improve, Remove campaigns. So that kind of goes through move your body, improve your health, and remove hazards. So before we get started, I just wanted to have a look at falls in WA and what that looks like. Each year, 1 in 3 people over the age of 65 experience a fall, and this becomes 1 in 2 people over the age of 80. On average, one Western Australian dies from a fall every 26 hours, requires an ambulance attendance for a fall every 19 minutes, is admitted to hospital for falls-related injury every 17 minutes, attends an emergency department as a result of a fall every 12 minutes. So as you can tell, falls are a serious public health concern in WA. If you're interested to learn more about falls in WA, I encourage you to hop onto our website and read the 2021 WA Falls Report. So as you can tell, falls are a major public health concern and are very common. They're common in people aged 65 and older. Falls have serious consequences. They can lead to trauma, pain, impaired function, loss of confidence in carrying out everyday activities, loss of independence and autonomy, and even death in some instances. Most falls occur because of multiple interacting factors, but leg muscle weakness and impaired balance contribute to most falls. There are evidence-based exercises that health professionals that work with older adults can implement and promote that can decrease the incidence of fall-related injury. And to talk more about this, I'd like to welcome our guest presenter for today, Dr. Jenny Conlon. Jenny is a lecturer in the discipline of exercise and sport science at Notre Dame University. She has completed her PhD examining the efficacy of periodized resistance training in older adults at Edith Cowan University in 2016. She's also an accredited exercise physiologist and scientist and a certified strength and conditioning coach. So welcome, Jenny.
Thanks, Apu. I will just share my screen. This one here. All good on your end, Apu?
Yep, looks good.
Cool. Good morning, everyone. Thanks, obviously, Apu and Injury Matters for having me this morning. I'm really excited to be here. It's been a little while since I've been able to present about this topic, which I'm really passionate about, and obviously I'm assuming most of you guys are as well, hence logging on. So yeah, we'll get into it. So obviously Apu's done a great job there at introducing us this morning, and I just do want to do a quick acknowledgement of country. So specifically the University of Notre Dame, Australia. We acknowledge that the Fremantle campus where I am today is located on the Whadjuk country, and I'd just like to pay my respects. Now, again, there's been an introduction to who I am and why I'm here, so I don't probably need to go over that, but yeah, I'm really passionate about this space. I love exercise training the aging population. I love seeing how much it empowers these individuals, and yeah, I think there's a lot of fantastic work happening in this space, and it's great to be a part of this area, I guess, in clinical exercise physiology where I'm currently placed. Now, in terms of the presentation today, sorry, I'm just going to move this out of the way. There we go. So in terms of the presentation today, we are going to do a quick, sorry, it just froze there for a second. So we're just going to sort of recap why we actually lose our physical function as we age, what's actually occurring physiologically. Then we're going to just do a quick recap of falls prevention, which Apu kind of already touched on a lot of that information. Then we'll get into the main sort of component, which is looking at this evidence-based exercise intervention. And then finally, we will wrap up with just a brief overview of screening and assessments that we can be utilising in this space also to help us on our way. Now, we're all well aware, again, I don't want to sort of just feed you basic information, which we're already all more than familiar with, but as we understand, demographic data indicate that most Western nations are growing older, okay? So in Australia specifically, older adults currently comprise about 20% of the population, and this is expected to increase to 25% by 2050, okay, give or take. Now, it's well documented that with an increase in age, we see an increase in clinical conditions. So, for instance, cardiovascular disease, osteoarthritis, type 2 diabetes. And obviously, we understand that these actually require extensive healthcare. They reduce the quality of life, and therefore they reduce independence in these individuals. And ultimately, this is causing this burden to society. Now, I think it's important to touch on and just quickly look at why this is actually occurring. Now, a critical process which underlies a lot of these, I guess, health issues as we age is the slow and inevitable loss of age-related muscle mass and consequent physical function, which we refer to as sarcopenia. Now, what you can see here on the left-hand side, we have a CT scan of a quadriceps muscle, and this is in a 25-year-old individual. So the dark grey area is the muscle tissue, and then you can see the surrounding white layer is that fat infiltration. Now, as we age, okay, if we don't do any kind of intervention, we can see that the inevitable effect of aging is causing the muscle mass to reduce and that fat infiltration to increase. So over the course of 40 years, we can see here that we're obviously, we're clearly losing muscle mass at quite a rapid rate, I guess, okay? Now, statistics show that over the age of 50 years, we're actually losing muscle mass at a rate of 1 to 2% per year. So, if we look at sort of 50 to 80 years, we're potentially losing between 30 to 60% of our muscle mass. Hence, we can all, clearly see there's going to be an impact on our physical function and our ability to undertake activities of daily living, etc. So just to speak to these physical consequences in a little bit more detail, we can see on the right-hand side here, we've got this figure that shows how our functional capacity typically sort of increases in early life, maintains in adult life, and then sort of starts to deteriorate as we get into those older adult years, okay? Now, what we absolutely want to try and do here, which is a big objective of falls prevention, is that we don't want to dip into that disability threshold as we age, okay? So there needs to be some intervention to ensure that we don't drop down into that danger zone. Some of the key sort of physical capacities that we lose as we age is our strength. So as Apu sort of already mentioned, particularly our lower body strength is really crucial when we're thinking about falls prevention. But it is this strength that's the main contributing factor to the reduced functional capacity that we see in our older adults. Another one that I want to talk to is power. Now, power, simply put, is the interplay or the optimal interplay of force and velocity. We often talk about this in sports performance and sports science, but if we think about it, it's this optimal combination of force or strength and velocity or speed. And it's actually directly related to falls experienced by our elderly populations and also activities of daily living performance, okay? So strength is absolutely important, but also our ability to be powerful, okay? So applying that force with some velocity. Finally, the last sort of physical capacity I want to speak to, which is often something that we don't necessarily think about too much, is our rate of force development. Now, this is sometimes referred to as explosive strength, and it ultimately measures how quickly we can develop force. So if we think about this, we can be really strong, but if we don't have the ability to express that strength quickly when needed, it doesn't really, it's not much help a lot of the time, okay? So if we think about an older person trying to balance on a moving bus, or trying to sort of stop themselves as they get to a sidewalk and they see oncoming traffic, or, you know, prevent a fall and quickly catch themselves, we actually need explosive strength to be able to do that. And that's why rate of force development is really important, because we do see this again drop off with our strength and our power as we age. And just to note there, just to highlight, this is obviously the space, like I said, that we're trying to make sure we reduce. So ultimately what we get is this positive feedback loop. So we have our sarcopenia, our reduced muscle mass. It's going to occur whether we like it or not. It is inevitable. We can certainly intervene to try and counteract it. But what typically tends to happen is we start to see our physical, these physical capacities reduce as we age. It's going to have an impact on things like strength, power, rate of force development. That we're therefore going to see this increase in the risk of falls and fractures, which has a knock-on effect to our functional capacity and our ability to perform activities of daily living. Consequently, we get an increase in disability and a reduction in our quality of life, and that's going to feed into us actually moving less and being more sedentary, which is absolutely what we do not want, okay? So that therefore results in this vicious positive cycle loop that we obviously need to try and break in order to intervene that cycle from just continually accelerating, okay? So we've already kind of spoken to these. I won't spend much time on this, but some important statistics around why falls are common, why they're so costly, and obviously trying to emphasize that it is a critical public health issue and it does demand our attention. And obviously people, I'm assuming attending today are really keen to be part of the solutions in this space. So we can see some pretty convincing statistics here, which are specifically in WA, and I appreciate not everybody listening to this is going to be based here, but we can assume in Western society that in Westernized nations that a lot of these statistics are going to be somewhat consistent. Again, this has kind of already been spoken to, but just to recap, we understand, of course, that exercise and movement isn't the only piece of the puzzle in falls prevention. It requires this holistic approach, okay? So there are many reasons why people might be at risk of falls. So for instance, they might have had a previous fall. It could be the poor strength and balance. It could be health conditions and medication intake. It could be poor nutrition, impaired cognition, poor vision, and obviously there could be hazards around the home. So we're obviously going to speak to the move your body, the exercise piece today, but we need to understand that it is only one part of the puzzle. We might be doing really well in the exercise component, but if there are hazards around the home, if we've got medicines and we're not necessarily taking care of our holistic health, then obviously it's not necessarily going to be an optimal process. So I think it's quite important to touch on that. And finally, I just want to point out the Stay on Your Feet website within Injury Matters is an unbelievable resource for all healthcare professionals, where we can get a lot more detail on these different areas. We can be recommended to different programs and services and all the rest. So again, I appreciate a lot of this is specific to Western Australia, but there's still some fantastic resources there that are going to be applicable to everybody in this space. So what we do know with falls is that they're not random events. So some risk factors do require different complementary intervention approaches. So just like I've kind of spoken to, if we've got poor vision, we're potentially going to need cataract surgery, lenses, and if there's different medications in the mix, then we're going to have to obviously look at those things within the healthcare team. But what we do know is that falls are not random events, okay? So we can prevent them, and this is obviously why we're here to listen today. However, important to note, as a single intervention, so if we can only do one thing, exercise appears to be the most cost-effective approach to falls prevention, okay? And that's a big key message that we want to obviously look into today. So we know that exercise is the prescription and exercise is the medicine treatment in this context, okay? Now, in terms of physical activity, I think it's important just to define a few terms and make sure we're all on the same page when it comes to talking about things like physical activity, exercise, etc. So physical activity, we can define as body movement produced by the contraction of skeletal muscles, and therefore we get this increase in energy expenditure. Okay, now we've obviously got our national physical activity guidelines. So even if you're not in Australia, it's, you're going to have some kind of national guidelines. And ultimately they're promoting this message of we need to move more and we need to sit less. And if we can do that, we're going to reduce our risk of chronic disease, and all sorts of these nasty things. So we understand that moving the body is extremely important. And no matter what our age is, we need to be moving the body on a daily basis. Obviously, we want to try and get different types of activities in there. And we know that the more we move the body, the better, ultimately, when it comes to that just holistic kind of broad health status. So we do understand that more active people do fall less, okay? So with our more active individuals, we're going to see fewer falls. However, important to note, there's no actual evidence today that demonstrates that simply providing advice to be more active is an effective falls prevention strategy, okay? So, okay, from a broad health perspective, asking our patients and our clients and our older individuals to be active, extremely important. But if we're targeting falls prevention, that as a standalone treatment is not going to fly. It's not going to be optimal in terms of that treatment intervention. And also important to note, again, in Australia, our national physical activity guidelines don't actually recommend any specific falls prevention kind of exercises. So we need to go outside of these recommendations, okay? Now, speaking to exercise, when we define exercise, we're talking about planned, structured, and repetitive movement, which is usually aiming to improve or maintain one or more components of fitness. So really important to note, we do not lose our ability to positively and significantly adapt to exercise as we age. Just because we're getting older and all these nasty things are happening that we talk about, everything kind of deteriorates, we can intervene that, we can break that cycle. So just because we're getting older, we don't lose our ability to adapt to exercise, okay? Now, as it's stated here, exercise is the most effective intervention for reversing sarcopenia, which we understand is underlying a lot of these issues that are happening, and the consequent decline in physical function, okay? And again, as a single intervention, we know that exercise prevents falls in community dwellers and in those at high risk of falls. So there's really strong evidence to support this. So it begs the question, well, if exercise is a medicine, what is the prescription? How do we actually prescribe this stuff, and what's the optimal way of doing that? Now, before I sort of get into the exercise evidence base, I just want to talk a little bit more broadly to the exercise sort of training principles that ultimately underpin any kind of exercise intervention that we're providing or we're prescribing, okay? And we usually, again, talk about this stuff a lot in our general pop, our more like high performance athletes, when we've got specific goals in mind. But in my opinion, and what's becoming very apparent, is there's no need to not look, there's no need, these are no less relevant in our clinical populations and our older adults, aging population, etc. Okay, so training principles do not discriminate. This is what we kind of need to keep in mind whenever we're prescribing exercise, okay? So training principle number one is individualization. So what we mean by that is individuals are unique and they're going to respond differently to the same training stimulus. So for instance, this could be based on training age. So how long have we been partaking in structured exercise, gender, and obviously considering issues such as past injuries, etc. So this is a really big one that I'm going to speak to a little bit today. We've also got specificity, okay? Now this is the idea that training adaptations occur specifically to the training stimulus applied. So we need to think about what muscle groups are we working, what's the intensity, what kind of movements are we undertaking. So the specific stimulus will produce specific outcomes, okay? Progressive overload, this is another one that I'm really big on. So the body must be progressively overloaded in order to continually adapt over time. Simply put, we can't just keep doing the same thing and expect that we're going to get these continual improvements, okay? We have to keep applying an overload, and that can look very different, and that can be applied in various different ways, but this is an important principle of exercise training over time. And then just quickly, diminishing returns. So training adaptations are related to the level of training. So as we become more trained and as we sort of, a year into more consistent exercise, we're not going to see the same sort of rapid adaptations and increases in, strength and whatever it might be, balance, etc., as we would have done it when we were first starting out. And that's totally normal and expected when it comes to exercise training. The more trained we are, the less we're going to see any kind of rapid improvements. But what we do want to do at that stage is simply maintain and take whatever additional improvements that we can. And then finally, reversibility. So when a training stimulus is removed for an extended period of time, and I'm sure we can all relate to this, we'll start to see a reverse in our training adaptation. So ultimately, we can't hold on to things, if we're not applying that stimulus anymore, okay? So I've just talked to individualization just for a few more, another minute or so here. Now, we've noted every individual is unique and they will respond differently to the same training stimulus. And I noted things like training age, gender, past injuries, all very important. However, other considerations that I think are really important in our clinical, more older populations, okay, are things like comorbidities. So we all know as we get older, particularly when we're working with our patients, we might be dealing with one issue, but there's going to be other things happening surrounding that as well. Hypertension, maybe some musculoskeletal issues, could be all sorts of stuff, okay? But the reality is we're going to have more comorbidities as we get older. And while we're trying to treat one thing, we need to be aware of what else is going on for that individual as well. Obviously, that ties into other treatment, what medications are happening, what kind of other interventions might be in place. And then one that is sometimes overlooked, what do these individuals actually like doing and what really do they not enjoy doing at all, okay? We're all human and we can't expect people to stick and adhere to an exercise program or any kind of exercise training that they really dislike and they don't enjoy. Now, obviously, there's an element of we need to educate, and as health professionals, we need to be a little bit persuasive at times. But I think it's really important to take that in mind. If we have an older individual who is really intimidated and doesn't want to be in a gym setting, why would we put them in a gym setting? We need to come up with different ways and look in our toolbox for ways that we can actually tailor things to their needs, okay? Things like accessibility, time availability, location, okay? So thinking about the big picture a little bit more, but what's feasible and what's realistic? What can we actually prescribe and expect these people to do over the long term? Even things like a support network, okay? Have they got people to keep them accountable? Are there people at home that can try and keep them on track and get around them as well? Obviously, their education. So if they have no idea why they need to do strength training and balance training for falls prevention, we need to provide the why. We need to, explain why we're asking them to do these things, and that will really help and boost that sort of motivation as well, okay? Or you would hope so, at least. And then finally, things like self-efficacy and mental health considerations as well. So again, looking at that bigger health picture, if we've got somebody who has really low confidence in their ability to undertake exercise, then there's going to be a different starting point for different individuals in that space as well. Now, Exercise and Sports Science Australia, again, I appreciate I'm speaking specifically to Australia. I think that's where most of our audience are sort of based, but this is the peak professional organisation for our tertiary trained exercise professionals in Australia. So as an accredited exercise physiologist with ESSA, I typically pay, close attention to ESSA position stands in my practice, okay? And this is a really key position stand that I'm going to sort of speak to today. And a lot of the information that I'm going to present in the following is within this position statement here, okay? So ultimately what happens in these kind of research articles is that key researchers who have expertise in this area, and they've built up a lot of sort of scientific articles, and they've done a fair few experimental studies themselves. They look at sort of, reviewing the literature, pulling all the studies together, and they present and really clearly summarize the body of research evidence, and they try and provide nice, clear recommendations for people like ourselves, okay? So this is one of the key documents that I've sort of referred to today, and I recommend that you get your hands on a copy. It's freely available online. So yeah, I recommend that you have a look at that one yourselves. Now, moving on to evidence-based exercise, which is why we're here today. I actually view this as a bit of a hierarchy when it comes to falls prevention, okay? Now, each level that I'm about to talk to is equally important, okay? And optimal results are observed when we have this combined multi-component program that actually includes each of the different levels and sort of strategies that I'm going to talk to, okay? So in terms of the foundation, well, we're looking at strength. We need lower body strength in order to be robust and in order to build the physical capacity to build, to sort of work up the hierarchy, if you like. So what we're looking at in terms of our strength training, we need to be looking at compound movements where possible. So looking at major muscle groups, multiple joints, rather than just bicep, tricep, well, that's not a good example because it's upper body, but rather than just single joint exercises, so leg extension, hamstring curl, there's nothing wrong with those exercises by any means. And contextually, that might be what's best for you. But where we can, if we can get compound movements in action, so things like sit to stand, so that squat pattern, even deadlift patterns, all these kind of things that are building in those major muscle groups, they're the kind of things that are going to give us our biggest bang for our buck, are going to give us the greatest outcomes and adaptations, okay? Obviously, it's a lower body emphasis. We know that lower body strength is what's highly correlated to falls. So while upper body strength is certainly important in our older adults, it's not necessarily our biggest priority when it comes to falls prevention. I've mentioned a few of the sort of movements and exercise examples here, but again, sit to stand, squat patterns, leg press, step ups, lunges, like I said, deadlift patterns, and even things like loaded carries. Okay, these are all great examples of movements, and obviously there's regressions and progressions of each of these that we can be applying to our patients and clients. Okay, so we really want to build this foundation of strength. That is the sort of big rock in the jar when we're starting out on this process. Okay. Now, in terms of power and rate of force development, what we can do is we can use some simple strategies and we can sort of facilitate them through the strength training that are going to help optimize power and rate of force development in our exercise, okay? So one thing that I'm going to speak to is this idea of performing exercises with maximal concentric velocity. Now, what I mean by that, we'll use a really simple example of a sit to stand or just a body weight squat. As we're pushing up and we're standing up, okay, so when we're working those quadricep muscles, we need to be pushing into we need to be performing that portion of the movement, the concentric portion of the movement, with maximal concentric velocity, okay? And what I mean by that is moving with intent and performing that part as hard and as fast as possible. Now, again, if we think of it more in the context of a leg press, we can probably imagine when we've got some load on that plate and we're having to push it away, we want to drive our heels into that plate and push it as hard and as fast as possible. When we start to load up exercises, they don't necessarily look fast from the outside, but it's that intention and that sort of drive to try and move this load as hard and as fast as I can. And we know that that is key to improving power and rate of force development. And we understand that they are really key physical capacities linked to falls prevention, okay? So we really want to try and optimize these and bring these to life in our strength training. So things like, push as hard and as fast as possible, that's a really important cue. Drive your heels into the floor. This could be a step up, this could be a lunge, this could be a sit to stand, a leg press, whatever it might be, okay? And then also thinking, so if you think about this in the context of cadence, we often talk about cadence in exercise. So it's a variable that we can manipulate. So again, if we're just thinking about a basic sit to stand, so these are seconds. So we've got a 3-second lowering phase, or eccentric phase is what we call it. So nice and controlled lowering, 0 or 1 second at the bottom, and then pop up nice and quick as fast as we can, okay? So we can talk about things like cadence and timing if that helps as well. And I have just noted things like jumping, landing, and hopping. These are tools that are really, specifically develop power, okay? And again, we might think, gosh, these are not applicable or relevant or safe for our older adults. Well, there's a lot of evidence to show that they are. And obviously, when they're coached and supervised appropriately, there are absolutely safe ways of implementing these and progressing these over time for our older individuals. I'm not going to get too much into specific power exercises today, but I just wanted to make you aware that things like simple, standing on 2 feet, jumping as high as you can, which might not be very high at all, but that's fine. It's the intent to produce that power, and obviously a nice, soft, safe landing. These kind of tools are at our dispense and can be implemented over time as well, once we've built our foundation of strength and once we start building that confidence in our clients and our patients, okay? So we've got strength. We're starting to utilize things like power and rate of force development strategies within that strength training. And then finally, we can start to build in some balance specific exercises, okay? Now, in my opinion, we want to perform these when we've got that base of strength, okay? That's going to make these a lot more feasible and a lot more effective. But of course, we understand that it's when all of this comes together in this holistic multi-component program that we're going to get our better and optimal outcomes, okay? So in terms of balance-specific exercises and activities, we can look at things like, graded reaching in a standing position, tandem walking tasks, single leg balance tasks, and then also dual tasks. So we can get people to perform these kind of movements or activities, and then we can provide a sort of dual task, whether that be holding a conversation, answering questions, whatever it might be. I'm sure you guys all have plenty of ideas in that space as well. But yes, again, just to reiterate, in my opinion, we've got this hierarchy and we need to make sure we're hitting each key component of that hierarchy, okay? So just to sort of go into this in a little bit more depth, I guess, and talk to a few different points. When we talk about strength and when we talk about balance, yes, we can have specific activities that are a little bit more, I guess, specific to those different spaces. But ultimately, the way I view this is a lot of our strength training does have a balance demand in there. So we can facilitate a lot of balance work through our strength training if we are prescribing it appropriately. And by doing that, we get this really effective, efficient model of training, okay? So we can see here on the top picture specifically, so we can see there's balance demands in these strength training exercises. Whether you want to call them strength, balance, it's movement, it's exercise, and this is what we need to be prescribing, okay? So we can get this sort of loading and this strength stimulus through the the loading of the body weight, specifically in these three images we've got here, or the gentleman seems to be holding some kind of dumbbell in the middle image. But then we've got this instability that the body obviously needs to sort of adapt to as well, okay? And that can be progressed from having, a chair on the sit to stand to removing the chair, to then having more of a, a single leg stance, making that a little bit more narrow, etc., making that more dynamic by starting to do some walking lunges, etc. So in my opinion, if we prescribe strength training appropriately and optimally, we are going to be training balance at the same time, okay? So again, we want to perform, this doesn't have to be overcomplicated. We've got our basic sort of movement patterns. We can regress and progress as we see fit. But ultimately, we know that these are going to involve our major muscle groups, again, of the lower body. And we know that these have a good transfer to our activities of daily living. So we're ticking all the boxes and we're getting our best bang for buck when it comes to training prescription. Now, the reason I've included the images here at the bottom is I do want to note that older adults are able to lift heavy loads, okay? They are capable. Now, there's a way of getting them to that point. We don't just start putting people under barbells and asking them to do deadlifts on day one. But I do want to reiterate that we shouldn't tiptoe around older people like I think a lot of the time we tend to do, okay? Now, again, making sure the correct, the qualified exercise professional is potentially leading this process within that healthcare team is really important. They're the experts in teaching these exercises. But yeah, in my PhD specifically, in my exercise training intervention, we had elderly people leg pressing, over 200 kilos. They're capable beings. Like we shouldn't, sort of be too tiptoey around the fact that, older people, when they follow the same sort of principles and guidance as we do when we train, we can get them really strong and they can lift some really impressive loads, okay? But it obviously takes time to get to that point. Now, the exciting thing is we have so many tools and equipment at our dispense, and all of these, what we see here, are ways of applying strength training, and we can also potentially use in like a balance setting as well, okay? So we don't have to have a gym membership, and this doesn't need to be complicated. It doesn't need to be expensive, and we don't need access to, fancy facilities in order to undertake strength training. So what I like to think of is, as a practitioner and healthcare professionals, we have a toolbox. There's many, many ways of undertaking strength training. It can look very differently to different individuals. And again, it all comes back to me for individualization. What can we get this individual to do and adhere to over the long term that is appropriate, safe, and effective, okay? We're also really fortunate that we live in a day and age where we can go down to our local, Kmart or Target or whatever it might be, and we can pick up a few of the tools that we can see on the slide here. And it's relatively inexpensive. We can build a little home gym, and obviously we've got our body weight as well, and that's all it takes a lot of the time, okay? So we don't have to get too complex and think about, needing far more than what's required. So top left, we can see we've got some ankle weights here. These are fantastic tools, again, when we're starting out, when we're working with our more frail, perhaps older individuals, okay? They provide that load to the lower body. And as you can see, we can use, perform exercises in a chair or walking or whatever it might be. Bottom left, we've got our dumbbells. We're all familiar with these. So, depending on the starting point again, we can obviously go heavier than this, but this can be a good starting point for a lot of individuals, just holding them as we perform our squats, our sit to stands, our lunges, step ups, whatever it might be. And then we've also got resistance bands, and these are a fantastic tool. So they're easy to transport, which can be a really good thing, okay, whether it's the professional or you're needing somebody to sort of travel with this or whatever it might be. But we have various thickness of bands, so obviously the more resistance there is on the band, the bigger the band's going to be. But again, we can strap these around a chair, we can use our own legs, and as a coach or a professional, we can be there and hold on to the band, whatever it takes. But really fantastic tools, inexpensive. We can travel around with them in our bag, and yeah, ultimately they're going to give us the same outcome if we use them appropriately, okay? Now I'm just going to talk on this slide to a little bit more specifics around this balance piece. So we've obviously spoken about the hierarchy. We know we need strength. We can start to sort of give some, use some strategies for power and rate of force development. And then we've obviously got our balance specific activities as well. Now, we know that balance involves this anticipatory and ongoing postural adjustments, and therefore we treat it as a coordination task, okay? As we keep saying, the initial level of balance exercise difficulty needs to be individualized like any of our other exercise components need to be, okay? But what we can do is we can progressively challenge balance via the following 5 steps. So we can start to minimize the use of hands to assist balance, so we can take away that aid, okay? Number 2, we can progressively use difficult postures or more difficult postures with a gradual reduction in the base of support. So for instance, we go from a 2-legged position to a semi-tandem position, to a tandem, to a 1-legged position. Number 3, we can use dynamic movements that start to perturb the center of gravity or the COG. So this could be a tandem walk, circle turns, leaning and reaching activities, and even stepping over obstacles. Number 4, we can reduce our sensory input. So this is things like standing with our eyes closed, standing or walking on an unstable surface, such as foam mats, for example. And then finally, number 5, as I've spoken to, we can start to use dual tasks. So for instance, tandem walking while actually holding a conversation or responding to questions, etc. So this is a nice, easy framework that we can use to actually progress those balance-specific activities that we spoke to. Now, again, giving Stay On Your Feet a plug. I'm a big fan of their website and their resources, and this is one of their links on the website. It actually outlines all the different evidence-based exercise programs that are currently out there in the community, okay? It shows you where they're running, what times, what the cost is, how you might need to refer a patient, etc. But whether or not you're based in Western Australia, again, a really good resource just to go in there and see what's happening. A lot of these programs aren't just running in Western Australia, they're running across the nation and most states. And if you are international, I'm sure you've got your own kind of, industry body that wouldn't likely have a falls prevention sort of area on their website, and no doubt lists a lot of similar kind of programs as well. Excuse me, I'm just gonna have a quick drink. So to summarize the evidence-based exercise piece, we know that falls can be prevented by a range of exercise programs which target strength and balance. What we also need to think about is programs that are listed here. We need to make sure that they're providing this warm community environment, they're non-intimidating, and they're going to promote adherence. It's okay having this fantastic program, but if people don't want to go back to it and continually do it over the long term, it's redundant. We're missing the whole point, okay? And we obviously want these programs over time to provide that challenge, but obviously do it in a safe manner as in our older populations, okay? So I just want to touch on Tai Chi, which was mentioned in the previous slide. There are evidence-based Tai Chi programs out there for falls prevention. There is some high quality evidence that suggests that Tai Chi is a safe and effective exercise modality for preventing falls in community settings. However, 2 things that I think are important to know is that it's currently unclear in terms of the evidence around its use for long-term care facilities. And second, there's actually an absence of evidence in the hospital setting as well. So contextually, we just need to think about, is it actually currently evidence-based for the context that we're considering? So what are some of the great improvements that Tai Chi can promote are improvements in balance, flexibility, strength, postural alignment. We know that there's additional benefits on cognitive functioning, and there's actually data to show that 71 to 81% of community dwelling older adults are adherent to class-based Tai Chi, which is a pretty strong adherence rate. So again, thinking about that enjoyment piece, what are people going to do over the long term? Because that's a really important piece of the puzzle. Just to note though, there are various forms of Tai Chi, so it's important to make sure you're choosing and sort of, selecting the most appropriate form for the client or the patient that you're working with. So next, I'm just going to briefly touch on yoga, which is a popular exercise activity for many individuals of all ages. We know that there's many proven health benefits with yoga. However, I think it's important to note that currently we do not have any convincing or adequate knowledge and evidence to show that yoga is actually effective in a falls prevention setting. So we do see small improvements in balance and mobility in older adults in a yoga intervention. But like I said, there's not enough evidence demonstrating the impact of yoga on falls equal to the other sort of exercise modalities that we've spoken to. And this is especially relevant when we're looking at chair yoga, which is gaining popularity. And again, it's a fantastic exercise modality for people depending on the context. But as a falls prevention intervention, we shouldn't yet be prescribing this, okay? So just to kind of summarize this, health professionals can recommend yoga to older people to promote physical function and mental well-being if there are no clinical contradictions. But there is currently insufficient evidence to recommend yoga specifically for preventing falls. And as you can see, there's a few references down the bottom there if you're interested in sort of having a further delve and a read about this. However, there is currently a randomized control trial underway in Sydney. Now, this is with a really big sample, 560 community dwelling older adults. So these are aged over 60 years. And what's happening is these individuals have been randomized to either the 40-week successful Asian yoga exercise program or a seated yoga relaxation program. So what these findings will eventually do is they'll help provide some important evidence regarding promoting yoga as a falls prevention initiative. So watch this space. Just because we're explaining this today doesn't mean to say that things aren't going to evolve and we're going to have different recommendations in a couple of years' time. We're in a scientific field and obviously things are constantly evolving and, guidelines are constantly being updated. But at this point in time, we're looking at strength, power and rate of force development, balance-specific activities, things like Tai Chi, different exercise modalities that fall into that realm. But yoga, unfortunately, is not currently one of them. Okay, so it's important to sort of, again, bring it back to that evidence base. Now, again, just looking at the exercise hierarchy, which we've spoken to, I just want to note this idea of holistic healthcare in our exercise intervention. Okay, so if we look at some of the common, really well evidenced benefits of strength training, we can see we're hitting a lot of different areas there. So we're getting a lot of bang for our buck when we're looking at the broad individual, not just falls prevention. We know we're here to talk about falls prevention today, but we're treating an individual that has a lot more going on than just wanting to reduce their falls or prevent their falls, okay? So obviously we've got the strength, the power, the rate of force development. Bone density is a huge one. We know that loading is super important for making sure we've got strong bones, particularly in females, okay? Activities of daily living, there's cardiovascular health benefits, metabolic health benefits, inflammatory status benefits, quality of life, our overall longevity. And then there's also this idea of reserve capacity. So when it comes to building strength, there's this idea that sometimes we might get to a ceiling. So we've reached our ceiling. We're as strong as, we're at a really adequate level of strength. Is there any need to keep pushing for further strength adaptation? Well, there's this idea that once we kind of reach that really well-trained status, we should always be continually looking to improve and continue to engage in that strength training stimulus, because the more strength that we build up, there's a concept that's considered that we build up this reserve capacity. So let's think that we unfortunately do have an injury, perhaps, we have some kind of illness and we are unable to engage with exercise training for a couple of months, whatever it might be, and spending a lot of time in bed. Well, this reserve capacity at that point, we can fall back on that. And we know we're not going to dip into those disability thresholds because we've given ourselves such a strong, important buffer. So I think that's a really important piece to think about when we're looking at strength training as an exercise modality as well. It provides all these holistic, broad benefits. It is fantastic in falls prevention, but we've got a lot more going on than that as well. Okay, so in terms of training efficiency and big picture, I think it's important to sort of acknowledge that. And then balance specific, of course, like I say, in terms of complementing and working together with that strength piece and with those power and rate of force development strategies, we've got this beautiful, multi-component optimal model of exercise training, and we're getting all these holistic healthcare benefits, okay? And I think just an important final note on this slide is we need to be realistic about how much structured exercise can we actually expect our older individuals to undertake. Again, this is going to look very different for different people, but starting out, we probably can't expect them to be doing 2 strength training sessions, 2 balance training sessions, X, Y, and Z. So we need to look at how we can be efficient in that exercise model, particularly in the early stages, because the likelihood is we don't all want to be having to undertake structured exercise, every day, multiple times a day, whatever it might look like. So just to highlight, we've got 2, so the ACSM is the American College of Sports Medicine. There's 2 position stands here that are from 2009. Now, these contain important guidelines for the modification of strength or resistance exercise for safe and effective prescription for older people. So again, 2 really important documents that I recommend. If you're thinking, this is all fantastic, but I need a little bit more help with how I actually apply this, these are 2 really great, helpful documents in that space. So the modifications that they talk about relate to things like the rate of progression, exercise intensity, the mode, and then the frequency of exercise as well. And the ACSM, for anyone that doesn't know, is a really big, reputable organisation in this space. So you're getting good evidence-based recommendations, okay? Now, I've spoken to ESSA, so Exercise Sports Science Australia. As we said, they're the peak professional organisation for our tertiary trained exercise professionals in Australia. Now, obviously, we've got various healthcare professionals that are listening in today and that are out there and can do fantastic work in the falls prevention space. When it comes to exercise over the long term, accredited exercise physiologists, which are 4-year tertiary trained exercise professionals, they are, I guess, the experts in this space, okay? So physios obviously have a really important role in that space as well and can do probably a bit more of the early stage stuff. But when we've got our individuals at a point where they're, adhering to exercise, they've got that strength base and they're able to sort of get into a more sustainable long-term training model. There are AEPs all over Australia offering fantastic programs. A lot of them would run the evidence-based programs that I spoke to that are available on the Stay On Your Feet website. But yeah, ultimately our qualified exercise professionals, they're well placed to implement the research evidence and to prescribe and supervise specific exercise aimed at preventing falls in both healthy older community dwelling people and those with comorbidities. Really helpful on the ESSA website, so essa.org.au. There's actually a search function, so you can actually pop postcodes in there, who it is you're looking for, any kind of special interested areas, etc. So it could be falls prevention, and it will actually show you who is accredited in that local sort of area or whatever it is that you're looking for. So just to sort of give that a little plug and make you guys aware of that. So the latter half of the presentation, I'm aware of time, so I will probably speak to this for the next sort of 5 to 10 minutes. But what I wanted to touch on today, and obviously what an objective of the presentation was, is thinking about screening and assessment in falls prevention as well. Now, the most common and easily implemented falls risk screening tool is these 2 questions here. So have you fallen in the last 12 months? And do you experience any difficulties when you're walking or when balancing? We need to obviously be aware that when our patients or clients are disclosing falls to us, we need to pay attention to the details and the circumstances of where a fall has obviously occurred, and that helps us determine the necessary intervention. Now, important to note, screening is not the falls prevention intervention, but it's obviously an important tool that helps us identify risks, and it's a great tool to start the discussion around falls prevention with older adults. It's not always a positive, nice topic that people want to talk about, but it can give us a sort of step into this space and allow us to open up that conversation. But again, it comes back to this question, well, there's many tools in the toolbox, there's so many surveys and physical, screening tools that we can use. Which should I actually be using? Well, before we sort of talk to some specific examples, we obviously need to ensure that from a scientific and evidence-based perspective, whatever tool or whatever screening assessment we use, it needs to have validity, it needs to be reliable. We hope to see external validation, i.e. it's being tested in different settings, or at least the setting that we're applying it to, peer reviewed, and obviously it needs to be contextually appropriate, okay? So these are all really important things that we need to consider before we start applying a tool in our specific context. So one that I'm going to talk to now is that, this is actually required in Western Australia, this is required for a falls specialist service referral. And this is the falls risk for older people in the community screen, which is referred to as the FROFCON. Now, really simple tool, okay, it's available for free online. It involves rating 13 falls risk factors on a scale of 0 to 3, which you can see at the bottom here. So it uses these 3 items that best predict falls risk in a 12-month period. So we've got falls history, we've got function, specifically activity of daily living status, and then we've got balance. It's got high retest and inter-rater reliability, and it's got a moderate ability to predict falls in older people, specifically those that are presented to the emergency department after a fall. Okay, so we know we've got a really solid tool here at our dispense. It's scientifically proven to be valid, reliable, accurate, specific, etc. And fortunate for us, it's quite simple to use. Okay, it's quite easy and simple for any healthcare professional to administer. So just to point out the latter half of the screen, okay, so you can see this is where you actually compute your total risk score. You look at your risk of being a falling, the grading of falling risks, and then it actually directs the recommended actions there, okay? And this can obviously be repeated over, longitudinally, so we can actually see how potentially falls risk is hopefully improving or, potentially worsening over time. So this is a really good one that I would highly recommend to have a look at. And then just to touch on, we've also got the Neura Quick Screen Clinical Falls Assessment. So this was developed by researchers at the Neuroscience Research Australia, so Neura. It's a multifactorial assessment tool, and it's designed for clinical settings. So it sort of acknowledges things like previous falls, medication usage, vision, peripheral sensation, and then obviously importantly, lower limb strength, balance and coordination, which we've been speaking to today. It has been rigorously tested in large community samples of community dwelling older adults, and it has been found to accurately predict fall status, which is fantastic, hence why we're recommending it as a tool that we can go away and have a look at and use. Again, quick and easy to administer, around 10 minutes, okay? It doesn't require any fancy equipment. So whether you're a GP, a nurse, a physio, an OT, an ex-phys, we can all be using this tool. So what it does do is it calculates the overall falls risk, and it actually determines specific factors contributing, which therefore, again, directs that intervention piece. So we want to do the screening and the assessment, but we obviously need to make sure that we're building this into that actual intervention pathway as well. Another really cool tool that I came across when I was doing this research is called the Icon FES app. Now, this is a phone application. We can all get this for free. Again, it's been developed by Neura, okay? And what it is it's a tool that allows us to assess the fear of falling using pictures to describe a range of activities and situations, which are all pretty much our activities of daily living kind of tasks, okay? So we've got an example here, of hoovering, vacuuming the house, and it's really nice and visually engaging in terms of trying to rate somebody's fear of falling while they're actually undertaking that task. So again, utilising this tool, we can start to build up this picture of where our individual is at and what some of those concerns might be. And finally, guys, just to wrap up, we've got various other tools. It's not to say that these are the only things you can and should be using. So for instance, the Centre for Disease Control and Prevention actually developed instructional videos of assessments that can be used to assess older people's risk of falling. These include your timed up and go, your sit to stand, so your 30-second repeated sit to stand test, and then also a 4-stage balance test. So again, freely available online. We know they've been tested, valid, reliable, and we get provided that normative data and how we actually rate people dependent on their performance. We've got also things, Berg balance scale. If we were in more of an advanced, sophisticated, lab kind of setting, maybe some exercise physiologists have access to force plates. We can look at those maximal strength measures, power, rate of force development, time to stabilization. All these kind of metrics are absolutely relevant. It's not to say we need them, but they can be nice if we can get them. And then even simple tools like hand dynamometry. So even though we're looking at upper body grip strength, we know that that is associated with overall body strength, and we know that that is highly applicable when we're looking at falls prevention, but just mortality and longevity and these kind of metrics as well. So to wrap up, I'm aware of time, so I'll quickly run through this. So we've spoken to this. Exercise, we all should understand, is the most cost-effective single approach to falls prevention. We need to consider our exercise principles and our evidence-based in the prescription, super important. And we do know that a multi-component exercise program should include our strength or our resistance, but also our balance-specific exercise prescription. We've got various tools and equipment. Obviously, that includes our body weight. It doesn't need to get, it doesn't need to blow out of control. It doesn't need to become complicated. Simple tools, they still produce some really great outcomes. We need to make sure we are reviewing high quality evidence, okay? So there's a lot of evidence out there. There's usually experimental papers to support and go against everything these days. So what we want to try and focus on are our, gold standard evidence sources such as Cochrane reviews, meta-analyses, etc. position stance, all the rest that we've looked at today. Accredited exercise physiologists can deliver appropriate exercise intervention and that maximizes holistic health benefits alongside that falls prevention goal. And we know that there's various simple screening and assessment tools available. We need to ensure they're valid and reliable. And we've obviously looked at a few different examples there today. And then finally, just to note, one of my favorite quotes, if we had a pill that conferred all the confirmed health benefits of exercise, would we not do everything humanly possible to see to it that everyone had access to this wonder drug? Would it not be the most prescribed drug in history? So thank you very much for listening this morning. I hope whatever your background, you've managed to take something from that. Please, if anyone wants to hit me up with any questions or keep in touch, I'm happy to be contacted on my email address there. And again, thank you to Apu and the team at Injury Matters for having me this morning.
Thank you so much, Jenny. That was such an interesting presentation. I feel like I've learned a lot as well. There's a few questions coming in. So if anyone has any questions for Jenny, please pop them in the Q&A box and I'll get that to, get Jenny to answer them for you. So there's one from Rhonda. What is the main cause of vertigo in older adults? It seems to be very common without treatment.
Yeah, to be honest, vertigo is not a space that I've actually done a lot of work in. Obviously, if I was working with as an exercise professional and with all my background in the strength training and more the treatment for the sarcopenia and the falls prevention, from a strength perspective, I would certainly be relying on other healthcare professionals to probably work in that space for me. I think there'd be a lot of physios that would be able to probably speak to that a lot better than I can. So just because I don't want to go out of my lane, I'm not the best person to answer that, unfortunately. But yeah, I'm sure there's heaps of information that you can get online if you look at, again, the right sources and make sure you're looking at the right evidence around that.
Fair enough. Thank you so much. I think I don't have any questions at the moment, so I will, try and wrap it up. Just a reminder that the Stay on Your Feet website has updated and has moved to the Injury Matters website. So the link is in the chat box if you guys want it. But yeah, all the information, it's all there. It's just migrated to a new part of the website. There's another one that popped in from Triana Coombs. What would you recommend a PT in a remote community that has clients seeking information about falls prevention?
Yeah, well, I guess there's various ways of doing that. I mean, Stay on Your Feet is an unbelievable resource. There's so many fantastic resources on the website. So if you haven't already, I really recommend you go check that out, because there's two platforms. There's for the healthcare professional and there's for the patient or the client. So obviously it makes it really easily digestible to provide, educational materials. And I mean, as a PT, you can still read all that information and you can educate in that space. You can obviously, refer out to exercise physiologists or physios if you feel like you're a little bit out of your depth. But I think as a starting point, Injury Matters website, get into the Stay on Your Feet sort of portal and just really dig around in there. There's amazing resources. So I think often we think we need to create all of this ourselves. We don't. There's already these organizations that are doing all the hard work for us, and we can just go on there and utilize those tools. So that would be my recommendation as a starting point.
Yeah, and we do have an e-directory for Stay on Your Feet that has a list of exercise and strength-based strength and balance-based exercises near you, so you can put your postcode in and look for any exercise classes that you can recommend to older adults in the community. So highly recommend going there and checking out if there's any close by as well. And there's a last one, Jenny, for you. Do you have any tips for getting older adults to buy into exercise for health? Often Emily finds it's the biggest challenge to get people started with exercise.
Yeah, absolutely. Look, it's quite a loaded question. I love it. I think it's such an important point. Behavior change, accountability. I found in my experience, elderly people are much more likely to listen to their doctor versus a young female that's trying to tell them, what they should be doing. Unfortunately, in the older population as it stands, it wasn't a normal thing for, particularly older females to lift weights. Like it's such a, there's a lot of stereotypes around that and a lot of misconceptions. So it's not that it's simple, but it's not easy. Education is so important, but obviously that's going to look quite different for different people. So I think you need to assess your audience, what makes them tick, help them find their why do they need to potentially do the exercise. But it's okay you telling them, but why is it going to benefit them? Is it because they get to be around for their grandkids longer? They can lift their shopping bags by themselves. They're setting themselves up for the next 10, 20 years to have the best life possible. It's a big question. There's a lot to it, but I think ultimately education and help your clients find their why, and then just drive that as hard as you can. And goal setting is really important as well. That can be a huge one in motivation. So having process goals and then outcome goals, and making sure you modify, evaluate those over the long term, and you keep people chasing towards something. I find that if we're chasing performance goals and we're seeing improvements, as soon as we get that momentum, we tend to get a lot more buy-in, and that's when the magic really starts to happen. But by all means, it's not an easy thing to achieve. I understand that, and I'm sure a lot of us know that, but we've just got to try different ways with different people. But I think we understand when it clicks, we're really usually onto something.
That's great advice. Thank you. I'm just going to start sharing my screen again. Sorry. There you go. So just to quickly wrap up, we have a Move Your Body campaign launching on Thursday this week. So Move Your Body just kind of goes over the points to improve balance and posture and strengthen muscles and bones within older adults. So it's kind of very similar to what we talked about today, just goes over those key messaging, and the Move Your Body campaign runs from 1st of September to 30th of November. And if you guys want to be involved, there's a Move Your Body campaign toolkit available to download. There's some resources there. You can order resources for your workplace free, and there's a lot of social media stuff that you can help just to share and get the message across within your client base as well. So yeah, there should be a link in the chat for you to download and look through. There's also the Improve Your Health grants open at the moment. They'll be closed from Friday, 14th of October. And applications for Improve Your Health grants go up to $5,000 to deliver community-based falls prevention projects throughout March to May of 2023. If you want to read more about it, there's more information on our website, but it goes over in individuals the key messaging, which is to check your medicines, fuel your body, and keep a healthy mind. And some upcoming trainings where Injury Matters hosts a range of different events around falls prevention and more broadly injury prevention. So there's some webinars coming up. There's one tomorrow on the COVID-19 impact on mental health in older adults, and one next week on incontinence and falls in older adults. So if there's any that interest you, feel free to register to any of the events on our website. There's an events tab that you can go in and register, and yeah, we'd love to see you there. And just a last thing, online learning modules, we do have one at the moment on the introduction to falls prevention if you want to learn more about just falls in general and why it is such a big issue. So feel free to log onto our website and do those free learning modules. And lastly, we have a Community Falls Network. So Community Falls Network is a group of health professionals that meet quarterly and just to connect with each other, to share learnings and solutions in falls prevention and safety promotion. So if you want to sign up, just flick me an email if you want to, and I can add you to the list. We also have Connected, which is an online networking program for health professionals working in the injury prevention space. You can read more about it on our website as well. There's a QR code there if you're interested. And lastly, evaluation. We'd love to hear about what you thought about today's webinar training, any feedback you'd like to give us. A survey, an evaluation survey will pop up after this webinar concludes on your screen. Please take the time to complete the survey and let us know what you thought about today. And thank you so much for tuning in. Thank you so much for Jenny for a great presentation. And I hope everyone learned something and took away something really valuable today. Thank you.